Good afternoon, good morning, good evening, depending on which time zone you're in, and welcome to YouGov's COVID-19 update for APAC and MENAP. My name's Will Arstein and I'm the Commercial Director here at YouGov. I'm delighted to have with me our Head of Research, Jake Gammon, and Sarah P. Jones from Imperial College London. Let me just throw to those guys right now. Sarah first, just to give a brief introduction about who she is. Sarah.
Good morning, I'm Sarah Jones. I'm a researcher at the Institute of Global Health Innovation in Imperial College London. And I am a researcher in behavioral health and also in charge of the collaboration between YouGov and Imperial College London responding to the COVID-19 crisis with respect to health policy.
Fantastic. Thank you very much, Sarah. And Jake Gammon, Head of Research.
Hello there, I'm Jake Gammon. I head up our ad hoc research across Asia Pacific. I'm based in Singapore. I've actually been with YouGov for about 10 years, but across many markets, so UK, US, and now Asia Pacific. So I'm very interested in these kind of results, especially when we can look at how all of our different regions react to the same common cause.
Fantastic. Thank you very much, Jake. And before we get started, a couple of housekeeping rules. First of all, we'd love to hear from you. There is a chat function within this application. Please do use it and jot questions down as we go. We will then try and answer as many of those questions at the end of this webinar as we possibly can. We are also recording this webinar. That is so that we can distribute this to a much wider audience of both clients and our prospects and our staff internally. And a copy of these slides will also be available afterwards. So without further ado, what are you going to hear from us about today? I'm going to talk a little bit about what YouGov is doing right now in response to COVID-19 and why we're doing it. I'm then going to hand over to Sarah from Imperial College London, who is going to talk a little bit about the science and the background to the work that YouGov is doing with Imperial. Jake is then going to take us on a tour of some of the data highlights, some of the insights that we're able to draw out from our COVID-19 trackers. And then I'll come and talk about next steps. If we've maybe got time, I can also look at some of the trends that we're seeing in the UK and the US. But let's first of all talk about what YouGov's work is at this moment in time. YouGov's #1 priority, as articulated by our board and our CEO, and demonstrated in the actions that we are taking, is about delivering and serving the public good. And by that, what we mean is making our data available to those that need it and want to consume it. So we're doing that with our public data, through our website, and through our media partnerships. But the main thrust of serving the public good is about delivering data to health organizations and governments that can make a difference in helping to stop the spread of the disease. And it is through that focus that we are working closely with Imperial College London, and I'll let Sarah talk a little bit more about that in a minute. We do, however, have a commercial offer around COVID-19. We are delivering syndicated and bespoke data sets to clients. These go deeper than the public data that we're putting out there, but are priced incredibly competitively in order that we are able to cover costs and support the public health organizations in the way that we want to. Now, that's as much of a sale as you're going to get from me. What I would like to talk a little bit about is our public data. So our public data is available on our website, and we've put some tools out there so that you can explore it yourself. What I'm showing here is just one example of a chart looking at all 26 markets where we are tracking COVID-19 amongst the population. And this is the proportion of people that say they are avoiding crowded public spaces. It's a little bit messy in its when you put all the data onto one slide, but this is updated on a weekly basis, and there are filters down the bottom so that you can look at data specifically. It is also available for download, and you can play with the times as well. So in terms of the markets that we're in, all 26 of them are listed on screen there. And the URL for our public data is yougov.com/free-COVID-19-tracker. If you are a client of one of our data products, so YouGov Profiles or YouGov Brand Index, you will also find in your account we have uploaded new data, we've uploaded new variables and new filters so that you can explore our YouGov's connected data through the lens of people's reaction to COVID-19. If you're having trouble finding that or trouble using that, then please do contact your local account manager, and they will be delighted to walk you through what is available there. But as I said, we're tremendously excited to partner with Imperial College London, and we're very, very lucky to have with us this morning Sarah Jones. So over to you, Sarah.
Thank you very much, Will. I'm Sarah Jones. I'm joining you from central London today. I have the privilege of writing my PhD at Imperial College London in a health policy research unit led by David Nabarro, one of 6 special envoys to the World Health Organization for COVID-19, and Lord Aradarzi, the former health minister of the UK, as well as Professor Hutan Ashrafian. Very early on in this crisis, Stephen Shakespeare and Marcus Roberts at YouGov reached out to me to ask how YouGov could help researchers. They made it clear that the research community would shape the YouGov response and that they would marshal all means necessary behind this effort. The result of those discussions is that YouGov has demonstrated extraordinary leadership in a whole company effort for the public good. Many people at YouGov are very kindly donating a considerable amount of time and resources in dozens of countries around the world. And from the research community to YouGov and all its employees, I first want to say thank you for your efforts, for your commitment. Your efforts are of enormous value to researchers and policymakers worldwide. My research area is consumer health behavior and developing ways of impacting people's attitudes and behaviors in a positive way. And let me tell you a little bit about what YouGov is donating to researchers and health policymakers around the world. The research will cover 29 countries, interviewing 30,000 people every week for the foreseeable future. The Imperial YouGov collaboration data will live at a free-to-web online repository being launched this week called the COVID Data Hub. This hub is very different from other epidemiological repositories such as Johns Hopkins or the World Health Organization, which focus on the growth in known cases of COVID-19 and the associated mortality rates. The Imperial YouGov COVID Data Hub will be designed to provide behavioral analysis to compare how different populations from different countries are responding to the pandemic. This has the specific intent of helping public health bodies in their efforts to limit the impact of the disease. Anonymized respondent-level data will be available for all public health and academic institutions globally. The questions in the survey were developed by a large collaboration of epidemiologists and virus modeling researchers at Imperial College London. They cover consumer data on testing, symptoms, as well as health policies such as mandated self-isolation, staying home, limiting contact with others, and the extent of compliance within 20 common preventative measures. The uniqueness of this offer from YouGov as opposed to other data organizations is very clear. Their early reaction has already set off a chain of collaborations in the research community, and I'm liaising with the Geneva-based headquarters of the World Health Organization to facilitate customization of the data for each market. Very briefly, global cases of COVID-19 passed the 1 million mark last Thursday, the 2nd of April. It took around 100 days from December to reach that huge number, but it has taken only 7 days for that number to grow by 48% to 1.48 million. Deaths from COVID-19 related illness are highest in Italy, Spain, France, and the UK, followed by New York City. New cases in China, which have largely been in Hubei province, have slowed from over 4,500 a day at its peak to 91 cases reported yesterday, mostly from those who traveled from outside China to inside. Japan is entering a period of rapid increase, with cases doubling over last week to 4,600. However, no lockdown has been mandated. Singapore has 1,600 cases with daily increases at about 100 per day. Australia has 6,000 cases with around the same daily increase of 100 per day. In Indonesia, although there are only 2,900 cases at present, daily increases of 200 per day have been persistent over the last 4 days. Malaysia, with 4,100 cases, has added daily cases at a steady rate of about 1 to 200 a day since the middle of March. In India, there are over 500 cases a day emerging, with 5,900 cases at present, while the country is in full lockdown. Iran has the 7th highest number of cases in the world, with 6,400 still with a daily increase of 2,000 yesterday, although the daily increase appears to be slowing. There are 38,000 cases in Turkey, with a daily increase of double that of Iran, around 4,000, which has been steadily climbing. There are 2,900 cases in the Kingdom of Saudi Arabia, where 1 to 200 new cases a day have been emerging steadily since the 3rd week of March. About the same 2,600, are in the UAE, but with a 50% higher daily increase than Saudi, with 300 a day emerging. About 9,400 cases in Israel, where the new cases per day have come down under 500 a day since Sunday. In North Africa, there are around 1,600 cases in Egypt. And in Algeria, Egypt, there are about 150 new cases a day. In Algeria, about 100 new cases a day. Now, what is a case of COVID-19? Colleagues at the Lancet published a useful stratification of what constitutes a case of COVID-19. At the top of the pyramid, those meeting the World Health Organization case criteria for severe or critical cases are likely to be identified in a hospital setting, presenting with atypical viral pneumonia. Many more cases are likely to be symptomatic, for example, with a fever or cough, but might not require hospitalization. Cases are being identified through hospital reports, links to international travel, through contact tracing of contacts of confirmed cases. The bottom part of the pyramid represents mild and asymptomatic cases. These cases might be identified through contact tracing and as testing widens via testing for antibodies or genetic material from the virus. However, it is worth noting that a test for antibodies at present does not give any information about whether the antibodies are protective, and if they are, for how long. There is, however, a growing recognition of the importance of the unreported and untested asymptomatic and mild cases. Now, why do researchers attempt to model the data and project cases? Modeling frequently starts with understanding the biological mechanisms of how a virus attaches and reproduces, and the environmental ways which it gets around, such as through sneezes, touching surfaces, and touching faces. Modeling the spread is actually not limited to projecting the number of people who will become ill. In fact, modeling the spread is primarily done with a purpose in mind. And that purpose is very frequently centered on what should we do about it. And what I mean by that is modeling is also for capacity planning for health systems, such as building temporary field hospitals, capacity planning for manufacturing of ventilators, masks, and other personal protective equipment or PPE that health workers need. Modeling will also hopefully tell us what anti-transmission policies and behavior in individuals is most effective, and I'll come back to that in a moment. What are these anti-transmission behaviors? A vaccine may still be 17 to 18 months away from global distribution, according to my latest conversation about a week ago with World Health Organization COVID-19 envoy David Nabarro. Many of us are home now because of policies and interventions being enacted to halt transmission. Wide-scale physical distancing has the aim of rapidly suppressing transmission to minimize the number of near-term cases and deaths. Colleagues at Imperial note that monitoring the population to test and isolate all identified cases and their household members as rapidly as possible will reduce transmission. Now, which countries are doing what? When we look to the Oxford University Policy Tracking Stringency Index, we can see how countries in the world begin to darken with each successive step they take with respect to policy. And could we advance the slide? This is how global interventions looked in January. This is how they looked in February. And at the end of March, this is how they looked. You see the countries darken as they take more and more precautions that are more and more stringent. But that color says nothing about how effective the policy is. So what is effective? Turning to anti-transmission behavior, policies, and interventions, researchers at Imperial have produced this estimate of how each policy on its own could broadly affect transmission rates. You can see clearly here that lockdown is modeled to have the greatest effect on transmission. However, you can also see it is not yet possible to know which other anti-transmission policies have clear superiority over others. This may be because in the European countries used to model this, the interventions took place so closely together that it remains difficult to understand which interventions had what impact. There will be much to say about the collaboration between Imperial College London and YouGov in the weeks ahead. This will include asking many people in the countries covered by YouGov to reach out to their academic, public health, and other stakeholders to collaborate with the researchers such as us on customizing questions for your markets. Modeling people's actual anti-transmission behavior specific to their countries with the help of YouGov data, instead of modeling only with theoretical behavior, may help to extend scientific understanding about how to use the existing transmission models. The hope there is that over time we'll understand better which anti-transmission behaviors are most effective, as well as which ones could potentially be relaxed over time and where. This kind of information is crucially needed as the virus continues to spread to new countries around the globe. Because transmission modeling heavily relies on the number of contacts one has both inside and outside the household, I have asked YouGov to provide us with data on the number of people reporting contacts outside their home. These figures have not been released to the public yet, and they have not been tested for statistically significant differences, but I can tell you that upon my initial inspection of the raw data about how many people the average citizen is coming into contact with outside their home, there does appear to be substantial difference between how citizens from countries such as Singapore have reacted to public health policies and how citizens from the US and from particularly hard-hit countries such as Spain and Italy are reacting. Now, according to the World Health Organization, testing, and early active contact tracing is key. There is now a presumption among researchers that many people carry the virus but do not show symptoms. These are the people at the bottom of the case stratification pyramid from my first slide. Since the beginning of the pandemic, researchers have sounded the alarm that without widespread community testing, every country is to some degree flying blind. Now, are people complying with health directives Will they continue to do so if restrictions continue? There are many ways of attempting to answer that question, and one place to start is by looking at some of the evidence about what is known to drive people's health behaviors. The health belief model of health behavior pictured here suggests the key drivers of a positive health behavior, such as stay home or work from home, include a person's perception about the severity of COVID-19 illness, a person's perception of their susceptibility to the illness, also what they perceive as the benefits and the barriers of staying home. Factors also include a person's general health motivations, and crucially, the cues from their body and their environment that they receive about the illness are very important, such as symptoms, a dry cough or a fever, public health campaigns, such as stay home or work from home, and even other cues such as ambulance sirens. Now, paramount to all of your business is the health and welfare of your employees, your supply chain, and your customers. Everyone on this call are in the unique and unenviable position of needing to forecast while taking into account uncertainties that have not previously been relevant to the realm of brands. Factors such as what policies are in place that affect your business, when they are likely to be lifted, how healthy are my employees, my supply chain, my customers. Some of these constraints are out of your hands. Stores and factories are shut, people are home or will be home soon, people are nervous, and many are falling ill. Credit is not loosening up in the banking system quickly enough to ensure supply chains can restart. In much simpler times, I have stood in your business shoes before. Prior to beginning my PhD at Imperial, I was the global marketing director of De Beers when it was part of the LVMH portfolio. I worry all day long, not only about health problems due to COVID-19, but also about the number of people whose jobs are at risk, how we've lost them, and how we are going to get them back. I've been asked many times over the past weeks how I would account for COVID-19 when forecasting global business. From where I sit, I know you are all doing everything you can to keep employees employed and to keep them healthy. To the extent that you're able to, you should include in your forecast models data that you are already no doubt collecting, such as monitoring your customers with usage and attitude data and customer purchase intent data to decrease uncertainty about rising and falling consumer demands. However, to further decrease uncertainty, you should also consider modeling how the change in virus transmission rates and the eventual decreases in daily cases can predict changes in local policy in your countries, such as stores being opened again and large public events being allowed. You should consider these factors in your top-down and your bottom-up projections to decrease uncertainty wherever possible. You should aim to do this in a market-by-market fashion, and you should combine these factors in a risk-based scenario. And let me conclude with this. It has never been more paramount that companies collaborate, share information, share new business models, new financing models, and new supply chain fixes. I urge each of you to collaborate within and between your industries, and please stay home to save lives. Thank you so much.
Sarah, thank you very much. That's fascinating insight into how the scientific community is looking at the issue, and also the way that you're using data to inform policy. Let me now hand over to Jake Gammon. Jake's taken a look at our consumer monitors that we've been running across APAC and MENA. He's also, for interest, added some European data in there for perspective, but enough from me. Let's hand over to Jake.
Thank you, Will, and thank you, Sarah. I think that's really fascinating information, and what we're going to go through now is some of that information that Sarah has talked about being utilized for that public good, and also some of the information that we are sharing on the websites that Will mentioned at the start. So a lot of this information you can get from here, but you can also get later. I'm also going to share with you some deeper insights that are not currently publicly available, but a little bit of consumer information to understand. So let me first talk about the method. As any research agency, we always like to talk about method first, right? So this is what we're doing. As Will has mentioned, we are running nationally representative surveys in every country across every week. We are interviewing 1,000 to 2,000 people per market. So you can see there we've got 2,000 people in Thailand, for example, and 2,000 people in Indonesia, and other markets we're surveying 1,000 people a week. We have been running this tracker for 7 or 8 weeks in a lot of Asian markets and 3 or 4 in the rest of the world. So we are going to focus on the last 3 weeks of data so that it's the most recent data for you to understand. Let me just take a moment to talk about what we're not showing and then what we are showing and why. So what we're not showing, we obviously have a limited amount of time and we would love to share a lot more with you. For the ease of space on your screen, we're not showing all markets, so we also have data on Taiwan, Philippines, and Vietnam that won't be covered in this, but is available on that website, as mentioned by Will. We're also focusing on top level with a few kind of demographic call-outs, but we are collecting data cut by a large number of demographics. And as you will see, we can look a lot at how whole nations are reacting, but also when you dig down, the picture isn't unanimous across that nation. So different demographics and groups within nations and markets react differently. So what we are going to focus on is the broad structure. So looking at especially those drivers of behavior that Sarah was mentioning. So talking about the level of fear of people and then what they're doing in order to protect themselves, how they're reacting to governments, and then how their consumer behavior is changing as a result of those broad behaviors. So let's look first at the level of fear. So just before we do, you will see a number of slides that look like this. So just to talk you through them, we've broadly grouped the region. It's a very broad region we're talking about today with Asia, Middle East, and Pacific. So we've grouped markets on this slide to try and make that helpful, with North Asia first, with China, Hong Kong, and Japan there representing North Asia. In the middle here we have Southeast Asia with Indonesia, Malaysia, Singapore, Thailand. Then there's India, Australia for Pacific, and Saudi Arabia and UAE there for the Middle East. So let's talk about the fear then. So the bars you are seeing are all those over these past most recent 3 weeks of data who have said that they are very or fairly concerned about they themselves contracting the virus. So we'll start in the middle with Southeast Asia. We can see here Malaysia is the highest here, but it's also been the highest throughout. So I mentioned we have some data going back further in a lot of Asian markets. Malaysia has been consistently the highest market, and that hasn't really done much to change over the last week, despite the drivers from the government on their behavior. Indonesia was consistently the second most concerned market. And so at first that was a bit of a surprise because Indonesia were very late in reporting any cases. So even when there were cases people were aware of cases in other countries like Malaysia, Singapore, Thailand, Indonesia had reported none, but the fear was very high. And actually, the fact that it's gone down again now may be about that reporting and the openness of information. Now that people have some information, maybe their fear is a little bit alleviated. If we look to North Asia, we can see China and Hong Kong, where they've had the most impact for the longest time. In these places, the level of fear isn't actually as high as the rest of the world, despite China having the virus for about a month before it spread elsewhere. The fear hasn't been as high in those places, and it's also remained quite stable, again, despite China's recovery. And then looking to the right and going towards the Middle East, we can see that the Middle East, the fear has been rising over time. Not quite as dramatic an increase. If we skip back to Japan, Japan has had the really big increases wave on wave. But the Middle East has kind of had a gradual increase over time. India's had quite a big jump, whereas Australia, again, things have been a little bit changeable, and maybe that's due to the restrictions. Finally here, just to go back to Southeast Asia and Singapore, Singapore has changed along with the government measures that have come in. And as you'll see over the next few slides, there is quite a lot of interesting information in there about how Singaporeans are behaving or reacting to how the government has been communicating. So let's contrast that with Europe quickly. As we've seen, the level of fear of contracting the virus, it varies by country within the Middle East and Asia. But it doesn't vary as much as Europe. And actually, it's only the countries most affected in Europe that have the same level of fear. So Italy here at the top being the most, the quickest impacted within Europe to that huge extent. That has got a very high level of fear, and France is quickly catching up with it, with the UK on the rise. But still, those levels are lower than we are seeing in Asia Pacific. And that might be something to also do with the history of the regions and diseases in the past, like SARS and MERS. You can also see Scandinavia, which has quite relaxed control at the moment, especially Sweden. The fear there is actually quite low. So we're going to dig now, we're jumping back to Singapore and Australia to talk a little bit about that thing where you can look at a country as a whole, but actually how are people reacting within it? And by contrasting these two countries and how their people in different demographics are reacting, we can see that there is no universal response, and actually different types of people, different groups of people act very differently. So looking first to gender, and we can see that across both markets, women are more concerned about the virus and their fear of contracting that virus than men are. That said, when there's a change in the fear of the whole population, then men and women don't necessarily react the same. So in Singapore, compared with the last week, which is the numbers kind of written out in the green and red, compared with the last week, women's fear increased by 8 percentage points, which was double the amount that men's fear did. So that kind of tells us that women are reacting differently in Singapore to men. Whereas when we go to Australia, actually, we saw that their fear increased overall, and actually both age groups, both genders, their fear decreased at the same level. So that kind of tells us that there's more going on beneath the surface. And then this comes up again when we look at age. So those aged over 55 are the most concerned in Singapore. And I think globally as well, we see older people are more concerned because there was a lot of talk and has been that older people are of course the most impacted group by the virus. So there's obviously a fear among that age group. However, when we look at Australia, it's actually the younger age group that are slightly more concerned. And this has changed in recent weeks. So I think the measures that have been brought in Australia have actually calmed the older population, feel a little calmer, whereas those who are aged 18 to 24, their fear has actually increased despite those measures. So we know that people are concerned, but what are they themselves doing about it, and what behaviour change is happening as Sarah and the academics are looking at? Well, we are going to look at a couple of hygiene measures here. We're going to firstly look at those avoiding touching objects in public, things like lift buttons and handrails on escalators, for example, and then we're going to look at masks in a moment. So if we look at people refraining from touching objects in public, we can see that generally speaking, this is on the increase as time goes on. So people are taking the advice more seriously. And we can specifically see this in Hong Kong, that's had a very big increase of that in the last in the last week, which might also be again due to the restrictions that they're seeing. We're seeing Malaysia is quite a steady rise, Singapore's quite a steady rise. India has quite dramatic rises, and actually so does Thailand. The jumps in those countries are much bigger. So that is kind of interesting to know that the public change is happening in bigger steps in those places. In Saudi Arabia, things are rising at quite a steady level, but they are still rising. Whereas in UAE, maybe they've settled down, maybe they are dropping a little. And that also could be due to stricter restrictions having been put in the UAE in the last couple of weeks. Finally, here you've got Japan, where actually it started, and although it has risen, it's still at a very low level compared with other markets. And I think especially those of us who work across markets know that certainly Asia, certainly Asia Pacific and the Middle East do not react the same, you know, within one big block, even though we often talk about them as one big block. So Japan, culturally being very different, has reacted very differently there. And while we're talking about cultural reactions, we'll move on to face masks. This is a conversation that has exploded in most of our markets and also in Europe and the US too. We know that Asian markets in particular are more comfortable, and it's a more normal sight or normal action for us within Asian markets to wear a face mask when we're sick. So it's not a surprise that Asian markets are reacting a lot stronger and deciding to wear masks. What I'm going to do here, though, is just pause for a moment to zoom in on Hong Kong and Singapore to tell a story of kind of two places here. So Hong Kong, this is a story of government reactions and how people have reacted on because of this. So Hong Kong, for example, very early on into the virus, Carrie Lam, the chief executive of Hong Kong, came out to give a public address wearing a face mask. After that, there was a run on face masks in Hong Kong. And since then, we can see that levels have been very high. I mean, that address was a few months back, but since then, all surveys we have seen, and we've been tracking since then, have had at least 8 out of 10 people saying they're wearing a face mask, usually 9 out of 10 in public. Now, after that happened, that had a massive impact on people in Hong Kong's lives. And so there was a shortage of masks very quickly, and shops ran out very quickly. Now, as businesses and as brands, we then look at that and see what can we do to help people at that time. And one thing that YouGov has, we have a daily brand tracking product called Brand Index. Looking at Brand Index, one brand in Hong Kong stood out, and that was Worsens, the chemists who sell face masks. They did an amazing job at trying to calm the situation, really great social media campaigns, and also rationing of face masks when people were going, stop some panic buying. And that had a huge impact on their sentiment scores. So people were really appreciative. And I think as brands, I think people are understanding that we as brands can work together. And I think there is a new consumer who is looking at brands on doing the right thing, not just in this crisis, but we're seeing it generally. And that's something for a brand to remember. And it pays off in people's perceptions towards that brand. Singapore, in contrast, had a very different governmental approach. Seeing what was happening in Hong Kong, maybe, they addressed the public very quickly to say, only wear a face mask if you yourself are showing symptoms. And so the usage of face masks in Singapore, where generally, in normal terms, they're probably around the same level as Hong Kong, they have not risen to the same levels as they have in Singapore. That is actually until recent weeks. So the World Health Organization information on face mask wearing changed, and the knowledge of the government that there must be a lot of people who are asymptomatic, such as Sarah was saying before. This has become something that the Singapore government are now taking very seriously. So over the last week, they have distributed face masks to every resident of Singapore, now has a reusable face mask. And you can see the change in policy starting to show there. And I expect next week it will have a huge increase based on this. Looking beyond face masks to support for government measures. So obviously, governments are bringing in lots of different measures, but how are people reacting to those? So looking at Indonesia, Singapore, and Hong Kong first, we see that different measures have different levels of approval. So the majority of populations are very approving of quarantining anyone who has been in contact with a contaminated patient. That is the chart on the right, sorry, on the left. And what we can see here is Singapore has just increased recently, and that's despite the contact tracing that everyone around the world has been looking to Singapore, and also governments like Korea. Despite that kind of becoming overrun, people are still very much in favor of it. Whereas quarantining whole areas has been slightly less popular. It is still a popular measure though, and again, we can see Singapore rising in line with government advice. And now let's go even deeper on Australia, which has seen a huge rise. So looking at the measure of all-out lockdown, Australians have increased their support of this measure has doubled in the last few weeks, and most of that happened in a 2-week period. So what happened there? Well, one of the reasons might be a lot of press within Australia talking about the case of the cruise ship in Sydney that allowed patients people who were potentially infected to have been let out into Sydney Harbour and let out into Sydney. So that could be one of the drivers for that huge kind of increase to then lock down the whole of the country. And then we see some interesting things there by age as well. So we can see 65 plus, again, older age group, understandably may support stronger measures more. What is interesting is that the second strongest support of lockdown isn't the next oldest age group, it's actually the youngest. And that's despite them having faced some criticism about how they've been reacting during this time. So let's move on now to a couple of consumer behaviors to see what we can learn about what is happening. So we look first at food, and I'm going to look first at the chart on the right, preparing food at home. And what we can see here is some markets have had just an astonishing amount of people saying that they are preparing more food at home. This may seem obvious, but what hasn't happened is, a lot of people saying that they've stayed the same. So Australia, we're seeing a large chunk of people saying they've stayed the same, but across Middle East, across Asia, we're saying a lot of people have increased. And that is probably due to, again, cultural differences in our markets, in our regions. So in Asia, for example, and the Middle East, there is a high prevalence of low-cost dining out options and much more cultural reliance on eating out. That has obviously shut down or been shut down because of what is happening. And so we're seeing a lot more people preparing food at home who wouldn't have done before. So this is a new exercise to them. And if we look to the left, we can see that there are major differences in ordering food delivery as well. So again, in Asia, in Thailand and Hong Kong, we're seeing a lot of people delivering more food online. There's a huge increase, but we're also seeing other parts of the region have huge decreases. So UAE, China and India have huge decreases in ordering food online. And if we skip to Europe now, looking at the same measure about ordering food online, and we see, again, those markets that are most affected by the virus and have had the most cases are the ones who are ordering food online less often. So here, Spain, Italy, and France. So those markets, plus UAE, plus China and Thailand, then it looks like there is a fear in some markets of online food delivery, and the concern that that may actually have an impact on contagion levels and people getting the virus from this, whereas some markets do not have that fear, and we saw it go up. So looking at food at home, again, we see a very similar thing in Europe to elsewhere. Again, the markets that are the most impacted are those that are ordering from home most often. Let's jump to look at what people are eating. And we tracked from the start whether people are concerned about the consumption of raw or uncooked meat. And this was because the media had put so much focus on Wuhan and on rumors that the virus started in a live animal market or a wet market. Looking at this, people have actually kind of stayed the same over time, with some countries responding and changing their behavior as time goes on. And as this rumor kind of fades away a little bit, we are seeing some countries loosen their concerns, such as Indonesia and Australia. Some are actually continuing with the concern that Japan has more people avoiding raw meat in recent weeks than they had previously. We can also see some age differences there, with older people avoiding consuming raw meat more than younger people. And we talked about the media there, so I want to kind of end the insights I'm giving you by focusing on two parts of the media that have shown interesting changes and behavior changes over time. So I'm going to start with YouTube, and actually I'm going to go back to talk about Hong Kong for a moment. Hong Kong, when the political situation got hotter in Hong Kong back in September, with the protests there, we decided to start tracking consumer behavior and what was happening in that market. And part of that was media and why people were consuming media. And what we found was this huge adoption of YouTube. And not just people watching it more, but we've also found that demographics of YouTube have changed. And there was a huge adoption of YouTube by older generations who have never used it before. So when we come back to this situation now and we look at COVID-19, we can see similar things happening in other countries, where we have 3 in 4 people in markets like Thailand, Indonesia, India, and 2/3 of UAE saying that they are watching more YouTube. And we also know from this research and others that they're relying on YouTube for news in particular. So this is really an interesting moment for YouTube and its prevalence across demographics it hadn't hit before. And then looking lastly at on-demand entertainment, what we can see is that people's entertainment habits are changing as well. So as time goes on, and especially as countries remain in lockdown for longer, people are changing their entertainment habits, and they are watching far more on-demand entertainment. And also, as we see, this is reflected in Europe, where on-demand entertainment and TV viewership has gone up. So again, as businesses, we've got to kind of have a look at what's happening in Europe and countries that were locked down in Asia before others, in order to understand what the impact is going to be on our markets. So that was some trend data that we have seen. I just want to give you a couple of key takeouts across the things that we have seen here and the things that we have seen behind the scenes. I'm very conscious of time. There's so much more data we could show you, and there's so much more data we're publishing publicly that you can go and look at on our website, so please do that. What we are seeing is there's a huge variation regionally, and that's not a surprise when we talk about such broad regions. But as well as the differences between those markets, we're also noticing huge variances within those. So we are noticing demographic differences that should not be forgotten about. As the government restrictions are introduced in markets, we are seeing some theories being decreased, but then in other markets we're seeing some increases. So we are seeing some of those behavioural changes that Sarah was talking about. We are seeing massive changes in people's consumption across all consumer behaviour. We've looked at the media consumption and dining spend, but actually consumption across all categories is evolving quicker than we have ever seen it. And we can look to other markets where things have happened before or after us to understand how this might impact us. And that's why monitoring is so important. So Sarah's told us why it's so important for the public health side, and for us as businesses, we want to be ready to offer our consumers the services they need so that they can continue a normal life. And behaviours change constantly. So the other thing we're looking at is not just which behaviours are changing, and some are going to change week on week, some are going to rise or fall gradually, but also some are going to stick. So what we're really looking forward to understanding next is which of these behaviours are actually going to stay. Back to you, Will.
Jake, thank you very much indeed. That's a fascinating tour of the data that we've got. As you said, it's only scratching the surface, but some really interesting insights that you're drawing out there. Okay, well, Jake has a chance to look at some of the questions, and we do have quite a lot of questions coming in. I'm actually going to skip the next part of the presentation and move on to what we're doing next. But if you do have any further questions, please do put them in the chat, and we're going to come on to those in a minute. So in terms of where we are going next, we are expanding our COVID-19 monitor suite. Sarah talked about the public data at the top of this presentation. That is, our public health compliance monitor. That is being delivered to Imperial and to other public health organizations around the world in order for them to help better model, understand, and inform policy to battle the disease. Our public tracker, which is the free data that we're putting out to the general public and businesses and any other organizations, is expanding. And I'll talk a little bit about more how that is expanding. Our standard consumer monitor, which a lot of the insights that Jake has been referencing, is evolving. When we first started this survey back in China in the middle of February, for example, it was important to understand people's awareness of COVID-19 or coronavirus. As we've rolled that question out to 26 markets, awareness naturally has climbed to about 100%. Therefore, it's not worth asking that question anymore. There are new and better types of question that we should be asking. What I'm really excited about this week, though, is the introduction of our economic recovery monitor. So that's launching a pilot phase this week, and then we'll be rolling out globally next week. And that's going to look at a number of things. It's going to look at consumers' perception of confidence. It's going to look at their current financial situation. It's going to look at major concerns. For example, global recession, runs on banks, permanent closure of businesses. But it's also going to take a future look and try and understand two things. What does the new normal look like? So are there sticky behaviors that have been created as a result of the virus that will continue on into the new normal, whatever the new normal is? And the second is, what are those normality cues that people are looking for? So what will help them to return to normal? Is it a lifting of travel bans? Is it the opening of their local restaurant or a bar? Is it the number of news stories in the media dying down? Or do they have a certain level of new cases being reported in their head that would trigger normal behavior? So those are the things that we're looking at and expanding on over the next coming weeks. And there will be further webinars explaining about what data we're collecting and drawing out some insights similar as we are doing here. But that's it. That's enough from us. I'm keen to get on to your questions for the last 7 minutes or so. But if you do have any further information after this webinar, please do reach out to your local contact. Or if you don't have one, there is a general email address. It is info@yougov.com. Right, questions. So while Jake is exploring questions, there was one very early on from Niraj. I think it was aimed at Sarah. And the question was, are there any data that supports that alone social distancing can reduce up to 80%? in any country, as few countries did everything together, but few take steps to reach lockdown. Also, the definition of lockdown is different in different markets. Sarah.
Yes, the estimates about social distancing produced by Imperial, for example, have very wide confidence intervals. They range from 30% to 80%. It's not likely to be possible to untangle the effect of social distancing on its own versus that of a lockdown in a country where a full lockdown is in place, such as here in England. However, researchers may be able to do so in countries that have not enacted stringent policies yet. Social distancing behaviors include working from home, except for key workers, staying 2 meters away from others, limiting contact outside the home. The data that YouGov and Imperial are offering to researchers around the world includes many of these social distancing measures and their trends over time. And as far as I'm aware, these will be the only cross-country compliance measures which show the actual behavioral trends over time. Because it's not possible to monitor entire population in large countries, estimates of the impact of social distancing on its own are likely to be based on either smaller subsamples of population who are followed closely over a long period of time to determine its impact. It is, however, worth noting that within household transmission is also one of the most important factors in limiting transmission. It's not just outside households. In lower income countries, average household sizes are larger than in high income countries. Households contain on average more elderly people in lower income countries, and these populations tend to have more underlying health problems, and this is contributing to the high mortality rates projected in these countries without stringent interventions from the government.
Fantastic. Thank you very much, Sarah. I'm coming to Jake next, and I think he's got a couple of questions that he can pick up on. The first is from Alex. Hi there. Do you have any insights on attitudes towards travel, whether people want to travel when restrictions lift, is the first one.
Yes, that's a great question. We are tracking, especially on travel, we're understanding at the moment how people's reactions have been to what they have done as a result of the virus. And we've managed to track over certainly the earlier waves within Asia, just before countries were locking down, as countries were locking down, we were managing to track kind of how people were cancelling their plans. So we've got fascinating information there on knowing at what point during the global reaction people were stopping their plans. Will spoke just a moment ago about recovery and what we're about to track next in terms of recovery across sectors. And I think that's really important for the next part. So there's another question as well about the economic recovery loosening in China. With these two things, that's what we're hoping to track next, both from a broad level, but also looking at things like the travel industry. We're very interested in that because it has obviously been hit so hard.
Fantastic. Thank you very much, Jake. I think there's a very short one to come at you next around, for your consumer monitor, will there be any info on the Malaysian market? Jake.
Yes. So we obviously had a very short amount of time and space to show everything, but I think there have been some questions on the Malaysian market, more information on Saudi Arabia, and then other markets such as how Sweden's reacting. So again, I just really want to express that the website that Will showed earlier, where you can get the free data for all the markets we're covering, all 26 markets. You can find data on all countries there. And our monitors, where we're pulling out some of the more in-depth data, are available in all of those 26 markets as well.
Fantastic. Thank you very much, Jake. Do keep those questions coming. We've got about a minute left and we'll try and get through as many of them as we can. I'm going to take one from Himanshu. What are the expected new normals when it comes to consumer behaviour in food and the beverage industry? The short answer is, at this point, we don't know, and that's just being very honest. That is why we're looking at running, in particular, the economic recovery module to see what are the new normal behaviours. We're not doing a deep dive in that one into food and beverage, unfortunately, but we are certainly considering looking at specific business vertical questions. So if you've got those, please do forward them to your local contact, and we will consolidate them locally. There are various hypotheses, however, in order to answer your question, looking at, do we see a rise in online delivery? Is there greater convenience? Is there actually a fear that is going to be amongst the populations of countries generally about gathering in groups? There was a fascinating piece on the UK media last night, a programme called Dispatches, that looked exactly at what the new consumer looks like. They had experts there from various think tanks talking about, are we going to have more of a fear of strangers going forward? Is there likely to be less gathering, less bodily contact, less handshaking, etc., culturally as a result of this? That's quite interesting. Jake, have you found anything else? And I think we're just about at time, so one more question from you, please.
Yes, actually, it's a question for you, Will. Could you please repeat the web address for the free data? Because yeah, I think that's the most important thing that people can look at next.
Sure, no problem. So for our public data, and I'll actually zip back to the top of the charts to put it on screen. But it is www.yougov.com/free-COVID-19-tracker. So thank you all very much. A huge thank you to Sarah Jones of the Institute of Global Health Innovation from Imperial College London, and to YouGov's Head of Research, Jake Gammon, for their insights this afternoon. Thank you all very much for attending and for your questions. As we said at the start, a copy of the deck will be available as well as a recording of this webinar, and we will send those out early next week. Many thanks. Have a good afternoon and a great weekend. Goodbye.